Thank you for watching this quick overview of your Mips final score for performance year 2018, presented by Dr. Jessica Peterson. This presentation was developed by the American Academy of Ophthalmology with support from Regeneron.
Why is your Mips final score important? Your 2018 Mips final score will impact your reimbursements for the Medicare Part B services you provide in 2020. Score less than 15 points, your 2020 reimbursements will be cut by up to 5%. Score more than 15 points, and you'll get a small bonus. Score at least 70 points, and you will also earn an additional bonus for exceptional performance. How will your Mips final score be calculated? It is a composite score that includes the weighted sum of 4 performance categories and up to 2 bonus scores. Those 6 scores will determine your Mips final score, which is capped at 100 points. The quality score is weighted at 50% of your Mips final score. This means that it can contribute up to 50 points. To get a score for the Promoting Interoperability performance category, you need to use Certified Electronic Health Record Technology, CERT for short. The Promoting Interoperability category is the only Mips performance category that requires the use of CERT. This category can contribute up to 25 points to your Mips final score. The Improvement Activities category is worth up to 15 points toward your Mips final score. You should be able to max out this score no matter what your practice size or subspecialty. Doing so will contribute 15 points, which is enough to avoid the Mips payment penalty in 2020. Your cost category contributes up to 10 points. You don't report any additional data for cost. CMS determines your cost score based on Medicare Administrative Claims data. In addition to the 4 performance category scores, there are 2 bonus scores added on to the Mips final score. Although the Mips final score is capped at 100 points, these 2 bonuses may help you achieve your goal. If CMS determines that you are in a small practice, it will add 5 points to your Mips final score, as long as you report data for at least 1 Mips performance category. A small practice is one that has no more than 15 eligible clinicians, based on historic claims data. If you treat complex patients, you can earn a bonus of up to 5 points. CMS determines patient complexity using 2 indicators of risk. The first being the average HCC, or hierarchical conditions categories, of your patients, and the second being the proportion of your patients who are Medicare and Medicaid dual eligible. We have now described the standard formula for calculating your Mips final score, which again is capped at 100 points. But CMS has offered flexibility for clinicians and groups who are unable to meet some of the Mips requirements due to circumstances beyond their control. If CMS determines that 1 or more performance categories don't apply to you, reweighting occurs. For example, there are several exceptions to the Promoting Interoperability performance category, so we'll start there. If you apply for and are approved for a Promoting Interoperability exception, the Promoting Interoperability category will be reweighted so that it is no longer a factor in your Mips final score, and the 25% weight will be shifted instead over to the quality category, which will then be worth up to 75 points on your Mips final score. Some of these exceptions are automatic and others must be applied for. You can also apply to have performance categories reweighted if you are subject to extreme and uncontrollable circumstances, such as a hurricane or a tornado.
The Academy is committed to helping all ophthalmologists succeed at Mips. Report using the IRIS Registry, know how to avoid the penalty, and bookmark the Mips hub page, which links to a wealth of ophthalmology-specific resources.